What's going on, everybody? My name is Dr. Frank. I'm the owner of Your Place Physical Therapy, and I am going to show you how to use a basic lacrosse ball. Tennis balls, golf balls can even be used for the same purpose, but very effective tool for releasing soft tissue throughout the body to facilitate reduced pain, better tissue mobility, better function of tissues, improved neuromuscular control, stability, all those things that help us feel better, move better, live better. So, first, we'll talk about the upper body, the shoulders, the chest, lower back, around the ribs, even in the forearms and things. So I'm gonna start with you can use a pillowcase, you can use a sock, anything that you could take this ball and throw it into. And then when it's down at the bottom of whatever it is that you have it in, take it and throw it over your back like this. And then all you're gonna have to do is lean up against the wall. And then you can kind of move around and try to find those spots that are the tightest and sorest and most tender. Those are the ones that you want to focus on across the board. So when you find a spot that gets your attention, it's like, man, that really is sore. Just sit there and hang out there. You can move around a little bit if you want to, and just spend about 60 to 120 seconds on that spot to facilitate that therapeutic release that is going to in turn help that area feel better, move better, promote circulation to it, and improve your brain and nervous system's ability to utilize those muscles consistently and more appropriately. So it'll help prevent compensations, postural issues, lots of things that increase our pain and inflammation in this area of our body. And you can bring it further down, get more in the lower back, same thing applies. You can also use it to hit muscles in the front, in the pectoral region, and the chest. You just lean into it this way and do the same exact thing. So find those spots that are sore. If you don't want to lean into a wall, especially in the forearm and chest areas, you can just disregard the sock or the pillowcase and just hold it with one hand and push it into the opposite spot. It's a whole lot less strenuous on your joints of your hands if you do this rather than pushing into things on your own. So just using that lacrosse ball, finding those spots and applying that pressure. And then same thing goes for the muscles and tendons most commonly associated with biceps tendonitis, triceps tendonitis, tennis elbow, golfer's elbow, those areas where you just take the ball, find those sore spots, apply that pressure. And with the tennis elbow and golfer's elbow, you could even do a little bit of mobilization with movement. So you could hold the pressure down and move your wrist up and down or open and close your fingers to get that tissue to glide underneath the pressure, which is even more therapeutic. So find those spots that are sore, hold it there. It's going to take a certain amount of tolerance to that pain, and it's almost like a no pain, no gain sort of instance for this type of thing, but it will greatly improve any sort of discomfort, limited mobility, weakness, those sort of things you might be having for tennis elbow, golfer's elbow, biceps tendonitis. You can roll out the biceps and do the same thing. Triceps tendonitis, you can roll back here. You can also lean up against the wall with it. So now I'm gonna lower this tripod down and I'm gonna go over ways to release soft tissue areas in your lower body as well. So bringing it down here. So I'll take this lacrosse ball, and for the glutes and piriformis, it's as simple as just sitting on it. So finding those spots, using your upper body and arms as leverage to kind of help you cruise around until you find one of those spots that really gets your attention, lets you know, hey, this is sore, this is an area that we need to focus on. From there, just sink into it and hover there and hang out for about 1 minute to 2 minutes at a time until that tenderness subsides. Then you'll know you've established a therapeutic release. And then you're gonna just continue to search around for other spots. You can go in the back of the hip for the piriformis, gluteus maximus, as well as proximal hamstrings. You can cruise over to the side of the hip for the gluteus medius and the gluteus minimus. If you wanna start looking at TFL and quadriceps, then you'll have to go more kind of face down and using it down through here and getting your body weight through it there for the quads. And again, you're just kind of rolling around to find these spots that really feel more sore than other spots and focus your attention on those. It would take a long time to use this lacrosse ball throughout your entire body. So 1 or 2 spots per muscle group is plenty to facilitate that relief as well as improve function and the things that are gonna help you feel better and move better. You can use it on the calves as well. Same thing, don't get too tricky with it. You just keep it simple. Put your weight of your leg down through it, keep your foot relaxed, and then just roll back and forth until you find those spots that are more sore and tender. And you can take 5 to 10 minutes a couple times a week doing something like this and really diminish the aches and pains that you feel not only during your workouts and athletic activities, but as well as throughout the day, that we kind of blame our workouts or blame our golf and tennis and running or whatever it might be on. And it's a very, very effective and valuable use of your time to help keep you as injury-free and active as you possibly can be.